Good afternoon, everyone. I see that it's right at 2 o'clock, so we're going to go ahead and get started. I wanted to welcome everyone to our Fresh Air Campus webinar on engaging students in a smoke or tobacco-free campus policy initiative. I am Molly Reese, ORISE Fellow with the U.S. Department of Health and Human Services in our Region 10 office. And before we get started, I just wanted to go over just a few housekeeping items. Audio for this webinar can be heard either through your phone using the call-in number or through your computer speakers. If you are listening through your computer and are having problems, please call in on your phone for better quality audio using that call-in information. Everyone who is calling in through the phone has been placed in silent mode just to cut down on some of the background noise. And lastly, I just want to make a note about the chat feature. If you should have any questions throughout the webinar, please use the chat feature that you can see at the bottom lower left-hand side of your screen to type your questions in, and we will field all of the questions at the very end of the webinar. We have about 10 minutes so we can address questions. So before I hand it over to our first presenter, let's go ahead and advance here. I'd like to share just some information about the Fresh Air Campus Challenge, which is a first-of-its-kind region-wide effort to encourage universities, community, vocational, and technical colleges to go smoke or tobacco-free. This initiative is a collaboration among the tobacco prevention programs in Alaska, Idaho, Oregon, and Washington, the HHS Region 10 office, and local partners. In the short term, our goal is to have all campuses of higher education in our four-state region sign on to the challenge and take meaningful steps towards a smoke or tobacco-free policy. And I do apologize. I noticed there's a little bit of a typo in the second bullet. It should say 2014 instead of 2013. And we really want all campuses to at least start the conversation this calendar year and explore what that process may look like on their campus. The ultimate goal for this initiative is to have all campuses in Alaska, Idaho, Oregon, and Washington to be 100% tobacco or smoke-free by 2016. We are proud to have 23 campuses throughout the Pacific Northwest formally sign on to the challenge. To date, we have 13 campuses that have signed on as a silver or bronze Fresh Air campus, which really means that these campuses are actively working towards a smoke or tobacco-free campus policy. Since our last Fresh Air Campus webinar in October, we've welcomed Seattle University, Edmonds Community College in Washington, and North Seattle Community College, who isn't listed on this list because they just recently signed on. Additionally, we have 10 campuses from across the region who have already implemented a smoke or tobacco-free campus policy that have signed on to our challenge and are committed to serving as mentors to our bronze and silver campuses. So a big thank you and congratulations to all of our Fresh Air campuses for your efforts in protecting the health and safety of your faculty, staff, students, and visitors. The Fresh Air Campus Challenge offers a variety of resources for both campus advocates and public health professionals. We have a very comprehensive website that hosts our challenge materials, our link to our online commitment form, and all of our archived webinars. And a large component of this challenge is also working to build up a network of campus and tobacco policy experts to share tools, materials, and lessons learned. One way we are doing that is through bi-monthly strategy sharing conference calls where advocates from across the region can connect in real time with your peers to pose questions, share information, and swap lessons learned related to smoke or tobacco-free campus policy. We also host quarterly webinars for our advocates on topics specific to smoke and tobacco-free campus policy. We've hosted a number of webinars so far. We've had webinars focusing on providing an overview and an in-depth look at our challenge, communication strategies for announcing smoke or tobacco-free campus policies, and strategies for launching a tobacco initiative on your campus. All of these webinars are archived and available on our website, which is listed here. Technical assistance is also available for Fresh Air advocates. Whether you're already engaged in conversation about tobacco on your campus or interested in starting a dialogue and need support resources or recommendations for how to get started, please get in touch and I can work to connect you with your local tobacco prevention and control expert. And together we can make sure that we are giving you guys the information and resources to support your efforts. Additionally, campuses that are participating in the challenge are also connected to a mentor campus who has already gone smoke or tobacco free and will be available to share lessons learned, tools, and materials with your campus. I'd like to share some information on an upcoming event, which can be a great opportunity for campuses to engage students on tobacco issues. On Kick Butts Day, which is March 19th, the Fresh Air Campus Challenge is hosting a region-wide event to encourage all campuses to take a one-day stand against tobacco by taking your campus tobacco-free for one day. We hope that this one-day event will serve as a catalyst for beginning or continuing a dialogue on campus on the benefits of quitting tobacco, end of smoke, and tobacco-free campus policies. In fact, we held this event in November, and 5 out of the 6 surveyed campuses who hosted a one-day stand on their campus reported that participating in this event helped to support long-term policy change on their campus. And to support students and staff in hosting their own one-day event on campus, we've developed an online toolkit that is available on our website. And the toolkit includes a set of promotional materials, a list of fun, innovative ways to raise awareness on campus and encourage ongoing dialogue, sample press releases, social media posts, basically everything you need to be able to host an event on your campus. Campuses that are interested in participating in a one-day stand are encouraged to register your event via our website or by sending me a quick email, and that way you can receive the latest information and updates about this event. Also, for a very limited time, we are able to offer free promotional posters and table tents to your campus. Here we have a picture of one of the posters that campuses can receive. If your campus is interested in receiving free posters or table tents, please get in touch with me or register your event through our webpage no later than February 28th in order to receive those materials. And we look forward to taking a one-day stand with you. And now, without further ado, I'd like to introduce our first presenter, Kimberly Homer Vagadori, Project Director for the California Youth Advocacy Network. And Kim has been in tobacco control for 13 years. She is a national expert on college tobacco-free policy, youth and young adult advocacy, and tobacco industry sponsorship issues, and has successfully coordinated system-wide policy initiatives in California. Ms. Homer Vagadori also provides technical assistance and training to local, state, and national organizations on issues such as youth engagement in local advocacy, tobacco in the environment, emerging tobacco products, campus-based cessation services, and tobacco industry targeting of youth and young adult. Kim, if you could press *6 to unmute your line. Kim, are you there?
I'm here. Can you guys hear me okay?
I can hear you just fine.
Perfect.
Go ahead and take it away.
Okay. Well, thank you, everybody. I'm excited to have an opportunity to speak with you all and share how we've been engaging college students and also others within the campus community with our tobacco prevention work and policy work in California. As Molly mentioned, I've been working with campuses for 13 years throughout California, and we also do a lot of direct technical assistance and training for our colleges, but we also do system-wide advocacy campaigns. We have 3 systems of higher education in California, and we are responsible for organizing students to get involved to advocate for some system-wide policy change. So just to tell you a little bit more about the organization that I work with, again, we are a statewide agency that's funded through our Department of Public Health with our tobacco tax. And we have 3 projects, a project that works to engage youth in local tobacco control projects, a program that focuses on the military community, so working with military groups, with military installations, and then also with student veterans to make sure that they have access to cessation services that are culturally appropriate, and that also we try to do some prevention with them, but unfortunately the policy side is a little bit difficult since it is at the federal level. So a lot of our work with military communities is focused on cessation and helping them quit. And then our college program, again, really does focus on policy and then also making sure that campuses have cessation services that do reach all populations on their campus and that they feel like they have the tools to do the local work. a lot of the partners that we have, I would actually say 95% of the partners that we have with the college campuses are not paid individuals. They don't have funding to do any tobacco control work. They're just really passionate about the work, and we're really excited to be able to provide them with different tools and resources and knowledge, and then also connect them with other campuses that are doing similar work so that they can advocate for tobacco-free policy adoption, implementation, and also we do a lot of work around policy enforcement. So today I'm going to be talking to you about the benefits of engaging students in the work that you're doing with tobacco issues, and also some general strategies for how to engage them, and then some opportunities for engaging students. And then just end the discussion with some tips and last-minute thoughts on how to engage students. And this is really across the board, understanding that not all students are young adults, but a lot of these issues that we hear with that I'm going to be talking about today really do pertain to young adult students, as we recognize that a lot of our older students have other issues and priorities and might not be on campus as long as our young adult students, in the sense that they probably don't necessarily live on campus or might not be as engaged in some of the student clubs. But this does reach across the board. We have a lot of students that we work with of all ages that are really passionate about tobacco issues. So the benefits of working with students, the first thing is that the students that we work with see things very differently in their communities. So this is something that we are experiencing a lot right now with some of these new tobacco products. In the tobacco control world, we look at products like e-cigarettes, and we use that terminology: e-cigarettes, electronic smoking devices, electronic nicotine delivery devices. That terminology is never used within the student population. They refer to, at least in California, we're hearing words like vapes, vapor, hookah pens, e-cigs. So we really learn a lot from the students that we work with on the problems that they're seeing, the issues they're seeing, the terminology that they're using for the different products. They also have a lot of unique stories about how tobacco and other public health issues impact them. So I actually just an hour ago met with a young adult student veteran who is now leading a tobacco advocacy campaign at his local college, and he said that he went in to go have a surgery, and they did just a quick scan of his organs to see how everything is, and the doctor told him afterwards that he could tell that he was a tobacco user, and that day he quit using tobacco because he's so young and he's already seeing an impact of tobacco on his body. That's a fantastic story. It's a very unique story that only he can share with other people, and that's a great opportunity for him to share his story about quitting tobacco, and also for him to be engaged with the movement. They're also experts on their communities. So a lot of times we always laugh with our young adults. We have a young adult student advisory board that we work with, and they're great at telling us, you know, what are people looking at, what fact cards or posters, or even they're, at least again in California, they're really into magnets and buttons right now. Those are things I never would have thought of, but they see them, they know it, they take them when they're given away, and so they're really able to give us that information. They're also heard differently among decision makers. A lot of times, even though they might be the same young people engaged again and again, decision makers like to hear from the students on their campus, and I think that it's really motivating to see that students are engaged and care about the issues that are impacting them. And again, they're also great with just getting other people engaged, and they know how to do it using different levels of technology. So what issues are important? This is something that I would strongly encourage you to ask this question on the campus that you work with and with the students that you work with, because every campus truly is different. But we've been asking this question right now. We've been doing some focus groups throughout the state, and we've been asking people what issues they care about. And these really are the hot button issues. The first is social justice. So something that very few people know about tobacco is the way that it's grown. It's grown in developing countries. It's usually grown by very poor farmers who owe tons of money to the tobacco companies because They buy them out, they promise them all these big things, and then they give them nothing for the product. It's also grown by women and small children, and a lot of these individuals have very serious chronic diseases by the time they're in their 20s because of all the toxins that they are exposed to when growing tobacco. So when you share this information, when you share what's happening globally with tobacco, it really starts to get people frustrated by it and gets them angry about this industry that's doing this to people in the United States and also abroad. The health equity issue is huge. In general, equity is a big issue that we're seeing a lot of with our college campuses. Our campuses lack diversity with certain populations, and so there's a lot of students who are talking about this right now and wanting to diversify the campuses. But then when we bring in the issue of tobacco and looking at, there are certain populations that definitely have higher rates of tobacco use, and there's reasons for that. Again, we look at industry targeting. And that's something that the students resonate with, and it makes them angry and want to do something about it. Environmental issues have been popular for a long time, but we do now have more information on tobacco waste and the impact of tobacco waste. And then looking at things like the growing of tobacco is a big issue because of all the deforestation it's connected with, global warming. There's all sorts of things. New and emerging products is also huge. There's a lot of misperceptions out there about hookah and e-cigarettes and little cigars. We're also seeing these products starting to be mixed with marijuana. And so because all of that, students really want to get engaged and do education because they're really blown away by what's happening and what's out there. And they're great to tell us the same thing about how they're seeing people using them. And then when we look at health, there are some, at least again with the young adults that we work with, when we talk to them about what health issues they really care about, the long-term things, like we did a big study a couple of years ago to ask them, what do you think about impotence? And they all said, that's not a health issue. It might appear to be sexy and get our attention, but the reality of it is that happens to a 50 or 60-year-old guy. That's not me. I'm 22. I'm going to quit before I graduate, or I'm going to quit before that can happen to me. So when we asked them, well, what do you care about? When we started to tell them about different things with tobacco, one of the number one things that they looked at was the addiction, and they hated that idea of being addicted to tobacco. And so when we tested these different ads with them, the number one ad that they really resonated with was this thought of addiction, a drug addiction, because, again, they didn't like the idea of being addicted. So when talking about the levels of engagement and how we engage people, there's this, I think a lot of times, especially I know within my world in tobacco control, we look at how can we get people engaged for the long term. But we've really come to learn that there are some people that want to be engaged in long-term activities like advocacy campaigns or to help long-term with doing communication and policies. And there's other people who might care about the issue, but they really can't commit long-term to it, so they might just want to be involved in one short activity or maybe help here and there, but they can't commit long-term. So we've really learned to be okay with that, to look for opportunities for maybe one-time engagement or for them to be engaged here and there, and then to find opportunities for people who do want to be part of a campaign or they want to do an internship and commit more time to the tobacco-free movement. So I'm going to go through and talk about what are some of these different, the short-term versus the long-term activities and how you can engage people. So again, looking at the strategies, we have one-time activities, and that's something that Molly had already talked about with the one-day stand, that you can get people engaged that day either by giving them education or getting them involved to volunteer and participate in events. There's a lot of great opportunities to partner with existing groups on campus. Something that's really unique with tobacco as a public health issue is that it goes much beyond being a public health issue. It is an environmental issue. It is a social justice issue. It is a women's issue. It's a labor issue. There's really so many issues that tobacco is connected into, and this is a great opportunity to partner with diverse groups on campus to get their support for things and then also to give them support for issues that they're working on. Another opportunity is to teach a class that's specific to tobacco, and I'll go more in depth with all of this in a bit, but then also to adopt a class, hiring interns, Something that does take more effort is to get the student government to take this issue on, and then, of course, the creation of a coalition. So you can see that in terms of your time and the energy and effort that you have to put into it, one-time activities for both you and for students are much quicker. Creating coalitions does take more time and maintenance, but in the long run, it is a great opportunity for the issue to be sustainable and to continue beyond just a month or a semester or even a year. So one-time activities, there's all sorts of them. Campus cleanups are really popular. Those have just taken off in our state in the last couple of years. Doing campus contests, focus groups are great. Those are really short opportunities for you to get 10 to 12 students to come into a room and to tell you what products they're seeing, what products they're using, what they think of your educational materials and your messaging. It's a really good time for them to have a voice, to be involved, but that's all they have to do is commit that one hour. And then town hall discussions and days of action, and I'll go more into depth with the italicized ones. So contest. We work with a group at UC Irvine, and they have been, for the last several years, every Earth Day, which is April 22nd, they do an event called Pause for a Cause. And this is an event where they ask students in their campus community to create a short video on how tobacco impacts the environment. And then at the end of the video, they ask them to put some information about quitting tobacco and information about health services. And then they open this up and people can create videos, and then they submit the videos on a YouTube channel, and then they open it up for the entire campus to view the videos and to score them and to provide feedback on the videos. And at the end of the contest, they are able to have money that was donated to give to the students as a prize. And usually students will partner up with a few other people. A lot of times student groups or different fraternities and sororities will do this as a collective group to create these videos, and then they can win $500, which is a great amount of money for, I think, anybody, but especially for students. And what this does is it creates a dialogue among students, but it also gives a lot more knowledge and information to different student groups who can then share that information a lot more broadly than just themselves. And it engages them at multiple levels, from, again, creating the video to scoring the video. So it's a really fun activity. It doesn't take a lot of work on the side of the Health Education Center. And then at the end of it, they have these fantastic videos that they can use as PSAs on their campus and in their communities. Town hall discussions are fantastic. There's a lot of pros and cons with town hall meetings. The con, I would say, is that sometimes it's difficult to get people to show up to them, but on the pro side, it's a great opportunity to let people have a conversation and for their voice to be heard. I was just laughing because the students that were in our office with us are from Cal State Sacramento, and I was part of this town hall meeting, and one of the first speakers to speak against the policy was this student who was a tobacco user who didn't think that the policy should be in place, that it was too restrictive, they needed designated smoking areas. And I just met him face-to-face today, and he is the new student advisor for the tobacco-free policy campaign at the university, because he actually started to pay attention to tobacco, and he learned of the health consequences of it, and he decided to quit using tobacco, and now he's heading up the whole campaign. So it was fantastic that he had an opportunity to voice his opinion at the town hall, learn more about the movement, and now he's involved in the movement. And again, some people have a really difficult time recruiting students. This one was heavily advertised, and they had 2 town halls, over 150 people at both of the town halls that just had an opportunity to share what they thought about the policy. It gave them a time to have a voice about it. Campus events, Molly again mentioned the one-day stand that took place in November, and then one that's coming up for Kick Butts Day. We do a bunch of them in California, and we encourage people to do one-day events for welcome events, welcoming people in, freshman orientations. Great American Smokeout is a great time to get students to volunteer for a day, or to get them to just think about quitting for a day, giving them information. We also do stuff around Veterans Day. It's a really unique opportunity to just acknowledge student veterans on campus and also to help them quit, just show your appreciation to them. And Veterans Day is also November. It's November 11th. January, focusing on cessation, and New Year's and helping people start the new year tobacco-free. February, again, focused on cessation and loving a tobacco user or former tobacco user. April, Earth Day, is a fantastic day to get health education out there and get the tobacco issue out there and connect it with an environmental issue. And then World No Tobacco Day in May. And then, of course, there's other times throughout the year, midterms, finals, big days that are associated with stress, and just getting information out there on how people can do other things besides use tobacco, helping people prepare for graduation and quit before they go out into the workforce. And again, these are all things that you can get students engaged by giving them education. If you're doing a policy advocacy campaign, it's an awesome opportunity to get out there with petitions or with surveys to collect data and giving them an opportunity to have a voice in the policy, and you can learn from them what might be successful or challenging with the policy. There's also great opportunities to partner with existing groups. So this is an environmental group that they partnered with. It was a group of students from public health that partnered with some environmental clubs on campus to do cigarette cleanups. And they were actually doing the litter cleanups as part of their advocacy efforts. They were doing it for data collection. And they went around, and for an hour they picked up cigarette butts, and there's a whole toolkit around how they do this, but they picked up cigarette butts and they recruited all of these different volunteers, not just from health education, but also environmental groups. And you can see here the 3 years that this university did this cleanup. It was just for 1 hour. It was a 1 hour cleanup, and they collected in 2012, 24,000 cigarette butts in 1 hour on their campus, and they did the math to show that that was about 200 cigarette butts per person per minute. So it was a really great way, not per minute, 200 per person. So it broke down, I think overall they range from 11 to 13 butts per minute that they were picking them up at the different institutions. Also to teach tobacco-focused classes. So this is a fantastic way of getting students to be knowledgeable on the issue, but then also engaged in doing advocacy efforts. So years ago, North Carolina Central University did an advocacy class. It was a year-long class. They recruited students who were interested in politics, were interested in understanding advocacy and community organizing. And for the first semester, they really just focused on what is advocacy, what is social change, what is community organizing. And then for the second semester, they put that new knowledge to use, and they did an advocacy campaign to advocate for a stronger tobacco use policy. And at that time, they were advocating for tobacco-free dorms, and they were successful. The students within that second semester of the class were successful in getting the dorms completely tobacco-free. And this was at a university that had a ton of money from tobacco companies. So the students made a really big impact on campus. Another example is a student-led class at UC Berkeley. UC Berkeley has these classes called DECAL, and students partner with faculty members to teach undergraduate classes, and it can be on anything. They have them on video games or rock and roll. And there's a group of students at Berkeley that for the last several years have been teaching a class on tobacco. And the focus of the class is just general tobacco information. They have a whole presentation on social justice and tobacco. They talk about all the new products. They talk about addiction, and they talk about cessation. And they've done measurements to look at the impact of the class, and what they found is that going into the class, a lot of students who actually take the class are tobacco users themselves, and by the end of the class, the students are interested in quitting or have quit, and a lot of the students are also interested in getting involved to create change on their campus around tobacco use, so getting involved in policy work. So it's a really great way to get people engaged, and also as part of the class, you can give them projects to do work on campus around your policy initiatives. So adopting a class, this is something that we just first saw this last semester. There was a communication faculty member at California State University, Sacramento, who decided to have their communication class project be the tobacco-free policy. So every semester, his communication class does different public advocacy campaigns. They're not all public health, but a lot of them are socially driven campaigns, and they focus on the communication of getting the word out and different messaging. And so they decided to focus the entire class on tobacco. Many of the people in the class were tobacco users themselves, and the students were charged with determining what policy they wanted to advocate for and how they were going to do it. They decided to, on their own terms, advocate for a completely tobacco-free policy. There had already been talk at the campus for the last 3 years. There was a small group of students advocating for the policy, but they just hadn't made a lot of traction because they ran into a faculty group that was very much against the policy. So those students partnered up with this big movement, Hornets for a Healthy Hive, and together they advocated for this strong policy. What was so unique about this was because it was a communication group that was pushing this, they made it very public and they made it very loud, and they did a lot of branding, and their branding was Hornets for a Healthy Hive, which Hornets are their mascot. And they broke up into these different groups to advocate for the policy. You can see all the students there. They hosted 2 town halls, and they did massive outreach on social media. So what was so fantastic about this was it was just a group of unpaid students who had to get to know the issue really well. They had to really take on the issue because they needed to advocate for it. They all really became believers of the issue, and they were all also very savvy when it comes to communication and PR because that was their major. And as a result, within 2 months of launching their campaign, this thing just took off in Sacramento. They had over 700 Facebook likes. They now have over 900 Facebook likes, which is pretty significant for a tobacco-free movement on college campuses. Within 2 months, they had 17 local newspapers, and not just in the Sacramento area, but in all sorts of communities throughout California. They were publishing news articles on them. They did a cigarette cleanup. They did 1 town hall meeting. They had 4 news stories on local news talking about the work they were doing, and they also collected a lot of petitions. And in the end, after 1 semester of this campaign, their president signed a new policy that will go into effect in 2015, and they were beaten out by 2 days. They're the second completely tobacco-free system within the CSU system, and the first campus literally announced they were going tobacco-free 2 days prior to this, but that's what they were really pushing for. And they made it into a big PR thing, and those were the students that I just met with prior to this webinar, and I asked them, how are you going to sustain this? And they said that their communication professor has committed to taking this on for another 1.5 years, and there will be 1 small group within that class that will be responsible for communicating the policy to make sure the implementation is done right. So they're going to continue it, and they're going to really take a lead on making sure that people know about the policy. Student interns and volunteers are fantastic to take on this as well, and they'll have credit, or if you're able to pay them, to give them an opportunity to do more work for you. And the value of working with student interns and volunteers is that they can really give you direct insight into the campus and into campus culture. It's also a great opportunity to work with students to do surveying, to do key informant interviews, so that they're really learning skills that they'll need within public health, but then also you can collect data and get information on what the issues are and get information that can help you change policy. They're also great for creating materials. They have dedicated time for development of materials, presenting information to decision makers. And then oftentimes student interns and volunteers, again, they might not be very interested with tobacco when they get started, but I've found a lot of people who aren't so interested with tobacco, you start doing it and you seem to fall in love with it, and then those students might decide to develop a student club on campus that then gets funding from ASB or ASI, and that club can continue. Another opportunity is to work with student government. We're finding a lot of student governments are really interested in tobacco issues right now, with more campuses going tobacco-free. And so getting student government to take on this issue and be the champion for it, and then it gives them an opportunity to really advocate for the policy and to carry it. And a lot of times if they're part of a system, they can share the information with their sister colleges, and oftentimes other student governments will take this on. The one challenge with this is that there is turnover. We know that tobacco-free policies don't always change overnight, and sometimes it may take more than 1 year. So you might have a student government that's really supportive of it, and then when the leadership changes, it might fall apart and the initiative could flatline, or you could get an even greater and more energetic group of students who advocates for it. So of course, with any of this, there's the pros and cons, but that's definitely something to consider with student governments. And then, of course, I think one of the hardest things to do, but it does have the longest sustainability, is creating a coalition. So this picture is two of our students from San Jose State University, and this was for a project that we had funding to do local policy work down at San Jose State to get their campus to go tobacco-free. And the woman on the right, we hired her to do an internship with us to collect survey data. And she became so passionate about the issue that she decided to create this student coalition. They incorporated it into health education class, and now that health education class does projects every semester. They do cleanups. They do a lot of education. They're still continuing to advocate for the policy. And now Isra, who's in this picture, became so connected to tobacco that this year she's now one of the American Legacy Foundation Fellows, and she's continuing to do her advocacy locally and nationally. So it's been fantastic for them to sustain this, and we haven't had to do much work besides just supporting them and giving them whatever resources they need. So looking at opportunities to engage young adults, there's so many opportunities to engage students and others on your campus to help with policy adoption activities. For example, collecting data, doing surveys, asking questions, meeting with decision makers to understand what the policy process is, or meeting with decision makers to tell them what the new policy should be and the justification for the policy. Students and other members of the college can also help educate the campus community. They can present to student clubs. They can present to faculty senate, to staff senates. They can just distribute information in person, online, through email channels. They can also create that information and set it up and make it so that it is reader-friendly for the people who you want to be reading the information. For implementation, this is definitely, I think, a lot of times we think that adoption tends to be the hardest part because it is very politically charged, but the implementation is very labor-intensive. It takes a lot of changes on campus, and it takes a lot of education. And this is a fantastic time to really engage students to help do the education. Many campuses are hesitant about doing any kind of enforcement with citations or fines. They just want to do peer-to-peer education. So this is a time that you can work with students and really empower students to have that voice, to feel confident to educate their peers. They can go out and they can distribute information on the policy. They can do brief interventions and share information about cessation, do referrals to cessation services for people who are ready to quit. They can also collect data about whether or not the policy has been implemented well. Are there signs that were supposed to be taken down that are still up? Are there ash cans that are still on campus that are supposed to be removed? And then they can, of course, participate in educational campaigns. So there's a campaign that we worked with that is from Ohlone College. They did this 2 rounds. It's called 100 People, 100 Days, and the second round they did was 30 people, 30 days. And they just recruited 30 people on their campus, and for one day that month, that one individual was responsible for doing peer-to-peer education and letting people know about the policy. And then the next day, the second volunteer for that second day was responsible. So everybody just committed one day to doing education and promotion of the policy, and that really showed to help increase compliance. So it's a great way to get more and more people involved with your activities. And this is just a picture here that a group of students from UCLA took, and they were collecting data on compliance of the policy, and then they're turning that into a whole project to show how the policy has impacted their campus community. And then it's also great to partner with students on cessation. So we really see that students a lot of times will feel really comfortable with talking to a peer about quitting or just sharing their experience with tobacco use or addiction. And so it's really beneficial to train students on cessation. It does take a skill set, But even just the concept of a brief intervention, having students be prepared to walk up to somebody and just talk to them and say, hey, when you're ready to quit smoking, here's a quick kit, or here's a card for a place that you can call to get more information on quitting, or here's some information about services provided at our health center. So students are great partners in encouraging quit attempts and doing brief interventions, and also just raising awareness about the policy. And I recently read a study where they looked at students who were in compliance with policies and students who were not in compliance with the policies. And what they said when they interviewed the students, they said, what might encourage you to comply with the policy or to continue to comply with the policy? And the students said, peer enforcement. Knowing that there is that social norm change, that my peers are encouraging me to either quit or to not use tobacco on campus, that would really encourage me to be compliant with the policy. So just some last tips on success. It's really important to learn what issues your students care about. So again, I mentioned some of the things that we've been hearing on campus. Of course, this is different for all of our campuses. We have some campuses that are very into environmental issues. They'll probably care more about tobacco waste and deforestation than campuses that maybe are really focused. The students are many of them have 2 or 3 jobs, and maybe the issues that they care about are the cost of tobacco and how much tobacco costs. That could be a big issue. So find out what the students on your campus care about and then how you can tie tobacco into those issues. It's so important to develop a partnership with the students and make sure that the students actually believe in the issues that they're working on, because then they really can become long-term advocates and get more people engaged and involved, and they're really passionate about the work that they're doing. We've been doing all of these focus groups, and when we ask the students about, what do you think about the focus groups, they say that to them, focus groups are so much more impactful than presentations because they actually get to have a conversation, and we get to listen to them because they're the experts. And what we found, we've been doing focus groups on new products, and what we've found is that they actually have an opportunity to share what they're seeing, and then they ask us a ton of questions, and we can share the information with them. Develop a strategy for what you're doing. Policy can't be done without a strategy, so do that, and make sure to have goals that can be quickly achieved so that they're winnable and you can celebrate them. At the same time, give people some certain tasks and deadlines so that they don't flake on you and that they actually know what they're doing and they can make their commitment and their promises to you. And then collect their stories and tell their stories to campus communities, because, again, students want to hear from their peers, and the stories that are out there are really incredible, and they make a huge impact, just like the story I just heard from the young man that visited our office today. So that was a lot of information. If you have any questions about anything that I shared, I'm happy to go into more depth or share any more information about any of the ideas that I talked about, and also, of course, share any of the work that we're doing here in California. My information is there, Kim, and then Beth is also our college program coordinator, and she does a ton of our cessation work. So feel free to reach out to us, and there's our website if you want any of our resources on our policy work or any of our new and emerging tobacco product work that we're doing right now. Thank you so much.
Great. Thanks, Kim. You shared a lot of really great information, and I do encourage people to check out the Cyan website. There is a lot of great resources there. Now we're going to hear from one of our local campuses here in the Pacific Northwest. We have a couple of faculty members from the University of Alaska Anchorage. Dr. Garcia is an assistant professor of public health in the Department of Health Sciences at University of Alaska Anchorage. His research interests include tobacco and alcohol prevention and control, health promotion and disease prevention, and racial ethnic health disparities. Dr. Garcia was a recipient of the Alaska Public Health Association's Short-Term Service Award in 2002 and the Barbara Berger Excellence in Public Health Award in 2012. He's joined by Dr. Joy Chavez Mapai, and Dr. Mapai is an associate professor in the Department of Journalism and Communication at the University of Alaska in Anchorage. She grew up in Seattle and graduated with her bachelor's and her master's degree from Washington State University. She graduated with her PhD in Communication and Society from the University of Oregon. Dr. Mapai's media research agenda includes television, new media, digital culture, and marketing communications and branding. Her health research agenda focuses on health disparities. Dr. Mapai has been recognized on the state, regional, and national level for her professional work and research. And if you guys can press *6 to unmute your line.
Hello, can you hear us?
We
Hello?
gotcha.
All right, great.
Okay.
Hello, everybody. This is Gabe Garcia, and welcome. We are from University of Alaska Anchorage, and let me see if I can move the slides here. Oops, it's not working. Hold on. All right. Good afternoon from sunny Alaska. It's actually sunny here today. And our new tagline in our university is "Amazing Stories Being Written Every Day." And so we have an amazing story to tell you, and it's a story of the UAA Smoke-Free Task Force. So a brief history about the UAA Smoke-Free Task Force and how we, in our activities. Well, we started off with collaborating with the nursing department of School of Nursing here in the University of Alaska Anchorage, the Health Sciences Department, and the state leadership on eliminating Alaskan disparities in tobacco. Our partnership then developed into getting the Asian Pacific Islander Community Wellness Club and nursing students and MPH students in our university to partner together to start forming a smoke-free task force. And our group then testified in the University of Alaska Board of Regents. And when a grant opportunity came up from the state, we partnered with the American Lung Association for this grant opportunity. Once we got this grant, we then have a more formalized UAA smoke-free task force. Once we formed the task force, we then, the first thing on our agenda was actually collecting data among our students. So this is just a snapshot of our online survey that we did. And basically, we asked the students whether or not they support a comprehensive smoke-free or tobacco-free policy in our campus. We also asked for their tobacco use and cigarette use. So let me share briefly with you some of our results. We had a good representative sample, and so the student demographics that you can see there on your screen are pretty much closely similar to the demographics of the actual UAA student body for fall 2013. So what we found was that close to 77% of the students at UAA do not smoke or use any tobacco. But what is concerning is that about 11% smoke cigarettes, 6% smoke tobacco products other than cigarettes, and 3.7% use a combination of smokeless tobacco product and cigarette. So combining all that, that's around 20% who smokes cigarettes or any form of tobacco. Good news with our survey, what we found was that 3 out of 4 UAA students actually support a comprehensive smoke-free policy. And when we look at the whether or not they support a comprehensive tobacco-free policy, what we found is that 70% of them support that.
And so we have data, and we were in the process of gathering data, but before we did that, we needed to have a campaign, an education/awareness campaign. And we needed to have a central brand from which all of these core messages will resonate around this campaign. We knew what we didn't want to have. We didn't want to have a tone of that was sort of anti-smoker, because many on the task force had people they knew who were smoking, in the process of smoking, or had maybe someone that they loved that was really struggling to try to quit. So we didn't want to have a tone that was nagging anybody or something negative along those lines. Instead, we wanted to have a core message that people could resonate around, could gather around it, and come together as a community. And so what we wanted to do was emphasize pride. And when we were working with our graphic designer, Maria Jose, a partner over at Hewitt Marketing Communications, the students and the task force mutually agreed that that's what we wanted to emphasize. We wanted to emphasize that people should be proud to have a smoke-free UAA, that this was a point of pride, and this was something that all Seawolves could mutually agree on, whether or not they're smokers, whether they're smokers, but something that they could have and be proud of to have on their campus. Instead of saying no, again, emphasizing the positive, we wanted to say yes to a smoke-free UAA. And the lettering and the branding on here, if you look at it, says say yes. Most of the time you see a lot of literature and a lot of marketing materials say no. And so we turned that on its head and said yes to a smoke-free UAA. It's interesting, too, because the smoke kind of pops out on here, and it kind of makes you look a little bit closer. Say yes to what exactly? It says say yes to a smoke-free UAA. And again, building on the whole notion of pride, we wanted to also emphasize that if UAA becomes a smoke-free campus, it would be the first University of Alaska campus to go smoke-free. It is also the largest campus university in Alaska as well, so that would be a point of pride as well. We decided to launch this education/awareness campaign at the campus kickoff. Now, this is an event that also includes the freshman convocation, so you have a lot of first-year students coming to campus. There'll be literally thousands of students coming back to campus or just getting acquainted with campus for the first time. So we thought this was the perfect opportunity to introduce our campaign, are proud to support a smoke-free UAA, a say yes to a smoke-free UAA. You can see on this picture that we had several bullets on there explaining some of the reasons why UAA should go smoke-free. Just a quick note, if you look on there, it says more than 85% of students are non-smokers. That was from a previous survey that we had done, that we had looked at, and the survey that we did showed that that number had actually gone down. So there were a lot more smokers that we found with our current survey. With the messaging for the campus kickoff, we also wanted to emphasize our new partnership with the Fresh Air Campus Challenge, that we were part of this regional effort to go smoke-free. And we put down a messaging that says, choose clean air, save a life, say yes to a smoke-free UAA. So we had those messages on our table. And no detail was too small. If you take a look at the table over there, you'll see we have candy that is a lifesaver. It's a mint lifesaver. So choose clean air, save a life, say yes to a smoke-free UAA. There's also a lot happening at this table. You see there are raffle tickets. What's going on here is that we were putting together an activity that would help engage students to be proud to support a smoke-free UAA, but to have fun at the same time. We wanted them to be attracted to our area. We wanted them to see what exactly is happening over there and how can I be a part of that. So a lot is happening at this table. For one, we're getting students to complete a survey. The other is we're having students sign up for permission for us to take their photo to be part of Facebook and also to be our next model for our smoke-free campaign. And we had these words up there on our tent. It says, choose your weapon. We had 4 different types of weapons that they can choose in order to kick butt. And what we had was a giant cigarette butt that people could use to attack. And then win fortune and fame. If you do all of the above, and if you sign up for that, you get raffle tickets. And win fortune, you got entered into a raffle of either winning a $100 gift certificate, $50, or $25. And win fame, you got to be posted on our Facebook site. So this is all that activity that was happening. You can see this young lady had chosen a sledgehammer to kick that butt and attack that butt. You'll also see over here in the foreground we have Oscar. He's a photojournalist. And we recruited him because we knew we were going to have a lot of activity happening. And we wanted to document that from the very beginning to the very end of this awareness campaign. And so Oscar was instrumental in that. And here he is taking pictures of folks, and we're posting on Facebook at the same time. So what's happening is that while we're taking pictures of them, this is also populating our Facebook page. Many times you don't think about having content already in place and showing your support as it is happening. And so we had people taking pictures, and then we also had people uploading pictures onto Facebook as this is happening. You can see people choosing various weapons of choice. You can see Sasha over here. She is kicking butt. Just students having a lot of fun with this. The one thing that we found was that this was so popular, and we actually had a lot of students really wanting to do this, that we actually didn't get a chance to tag the students. So when it came time to putting a name with the face, sometimes we didn't have that name because so many students were signing up, so many students wanted to take part, that it actually became really hard for some of the folks manning the table. They weren't even getting any breaks because we had so many students signing up to take part in this activity, and that we didn't get a chance to tag students as this was happening. Even Oscar, the one taking, our photojournalist taking the picture, didn't even get a chance to have a break or even drink some water. This was a really hot day that this was happening. And so for, I think, lesson learned for the next time, we're going to have a lot more people manning the table. And so this is one of our contest winners. So she signed up to have her picture posted on Facebook. We drew a raffle ticket at the end of the campus kickoff, and we called the folks and just let them know that, hey, by the way, you won a gift certificate. Thanks for taking part. Thanks for being proud to support a smoke-free UAA. So the campus kickoff was our kickoff to this awareness campaign. After that, we had a variety of different events. We did a lot of tabling. So we went to different places, we tabled, we gave informational pamphlets to students, the reasons why they should support a smoke-free UAA. Another one is a debate. The Department of Journalism and Communication has an award-winning debate team, and we partnered with them along with the Center for Community Engagement and Learning, and we put together this debate where students got to debate the merits of a smoke-free UAA. And this is one that featured student debaters, and the one speaking actually is introducing the event. That's Valeria Delgado. She is one of our student leaders on the task force. So we also had the chancellor in attendance at this debate. And so we found that the students were really engaged. This gave them an opportunity to talk about what was happening on campus. What the debate also did was it woke up the opposition. Prior to this time, we just had a couple people posting on Facebook telling us that, this is something that they might not support. But after the debate, the opposition woke up, and woke up in a big way. This is a mock site, or this is a site, a parody site that they had produced, and they had their own Facebook site saying no to a smoke-free UAA. They even got it down to our logo even, proud to oppose a smoke-free UAA, where you can see that the cigarettes are very much intact. While this was happening, on the Facebook side of things, it was important because we were still trying to get students engaged, that we also took steps to boost some of our Facebook posts during this time. This is important because the other Facebook site was gaining momentum, and I think they had 88 likes, something along those lines. We still had a lot more than that, but we didn't want it to close the gap in any way, and we just wanted to make sure that we were promoting our site heavily. Those in tobacco control should be very pleased to know that Facebook also supports tobacco control. If you are promoting smoking or tobacco use, you are not allowed to promote on Facebook. You're also not allowed to buy ads. Our ads to boost some of our posts were actually rejected because they thought they were promoting cigarettes and promoting smoking, when instead it was the opposite. And in addition to the opposition, we spent most of our November sort of dealing with the opposition and dealing with some of the messages surrounding this. We also reached out to our partners. this is where Molly and being part of the Fresh Air Challenge really became critical and very important. How can we help each other? Well, we could basically go on the Facebook site. And what we had partners from different parts of the region coming to our aid and sort of defending why UAA should go smoke-free. We also had some campuses in Alaska who had already gone smoke-free also posting on our Facebook site, so that became very important. Again, a lot of this happening, and in addition, more tabling, more education, more awareness, and during the Great American Smokeout, we also had our chancellor come to our support by designating UAA smoke-free for a day. And this was a really big win in our column, in that the chancellor would recognize the importance of this day and recognize the importance of our efforts. In order to get him to sign this proclamation, one of our student leaders actually reached out to him, asking him to help us with this cause. So here we are in spring semester, and we have Sasha now, who is, we replaced the other model, who was a stock photo model, with a real UAA student, and this is Sasha kicking butt. And for the spring semester, our focus is basically trying to get people to vote for a smoke-free campus, trying to get students to vote for a smoke-free UAA. The students on the task force did a lot of groundwork on this, in that they got a referendum from the student government in order to get this on the ballot, as opposed to going through the petition route where we had to collect 600 signatures in order to get it on the ballot. And so here are the students that are part of a different that are part of the class that I'm teaching right now, and basically it's a class on counter-marketing and social marketing. And these students, I was telling Gabe, I feel old looking at this picture. The two students in the middle are actually now the president of Northwest Strategies, and also somebody who works with Northwest Strategies, and they help to do tobacco control for the state. And it's a marketing / public relations company. And the other ones are some of my students taking part in my counter-marketing, social marketing class that is related to the Smoke-Free UAA campaign. And so they're developing messages, and they're working to collaborate with different groups, different classes, a social work class, a dental class, a health sciences class, trying to rally students in order to get students to vote for a smoke-free UAA. And here is one of the groups that support us, and you can see that we're now starting to have groups take pictures with our smoke-free logo, talking about a smoke-free UAA, and giving that support to the campaign. We also have a Fresh Air Challenge event that's going to take place on Monday, where we're going to advocate for the rest of the colleges and universities in Alaska to also go smoke or tobacco-free as well and join the challenge. And so the 5 takeaways for this, basically, keep it positive. We didn't want to go negative with this. We wanted everybody to feel pride and to say yes to smoke-free UAA, understand the process. The whole referendum process sort of took us a while, because there are different nuances of student government in terms of what specifics you need in order to get something on the ballot that we had to go through. Collaborate. We're collaborating with different classes, different groups, in order to advocate for a smoke-free UAA and to rally the vote for April 8th, and use the network. The Fresh Air Challenge is vital. It's critical, and especially coming to the aid when your maybe when your campus is just getting started. So that was really important, and we found that out when the opposition began its campaign. And lastly, collect and use data. We're going to be using the data that we collected to formulate different messages, and ones that we hope will help students understand the importance of this issue and vote yes on April 8th for a smoke-free UAA. And that's it for us. Thank you.
Great. Thank you so much, Drs. Garcia and Mapai, for sharing your lessons learned and the creative ways that you're engaging with students there at UAA. I see we're a little over on time, but I did want to just open it up quickly if there's any burning questions. I also do want to remind participants that the recording of this webinar will be available on our website, and the link is there. So if anybody wants to use the chat feature on the lower left-hand corner for either Kim or our UAA faculty members, please go ahead and type in a question. And our first question is if there is any good suggestions for funding. And I don't know if any of our presenters are able to field that question.
This is Kim. That's a fantastic question and a very common one we get here. I'm not sure of any great sources of funding. Unfortunately, even though colleges are a big priority nationally now through Health and Human Services, I don't know that that means that there's been any increase in funding for them. However, there are definitely partners on campus that may have funding to do tobacco work. For example, American Cancer Society, they have a group called Colleges Against Cancer, and they oftentimes will work on advocacy initiatives around tobacco and might be able to provide resources or support. Another thing that we found to be really useful is if you are able to partner with some students to start a student club, they do get funding for their club from their student government. And so that's a way for them at least to be able to get some sort of stipends or for them to be able to have some funding to get materials. But in terms for funding for time and staffing of these initiatives, unfortunately, there's no central place to get that other than, partnering with counties or other organizations that might have a little bit of seed money for you. Sorry, I don't have better suggestions.
This is Gabe Garcia, and I think one of the key things that we did was partner with the American Lung Association of Alaska, and there was a grant opportunity from the state of Alaska to address the problem of tobacco use among young adults, and so that's how we obtain our funding. And I think funding is really important because in order for us to do a lot of these creative ideas that we have, it really takes a lot of time and effort and energy and money to do all of these.
Great. Thank you, everyone. And I would also add in that although the financial support may not be there, there are resources like the Fresh Air Campus and your local and state tobacco prevention and control experts who can provide a lot of staff time and a lot of resources and that knowledge to be able to support efforts. So I see we're about 5 minutes over, and I don't want to take any more time. I see there's 2 more questions that came through. So I think what I'll do is I'll close this out now, and I'll work with our presenters to answer those remaining questions, and then send out a follow-up email to all of our participants here. If anyone has any other burning questions that they weren't able to add into the chat feature, then go ahead and shoot me an email at molly.reece, R-E-E-C-E, @hhs.gov. And we'll make sure to get all of those questions answered. I want to thank all of our presenters again for taking the time to join us today and really just to share your expertise and experiences with everyone here. So with that, I will go ahead and thank everyone for joining us, and we'll see you next time.